Okay, hello everybody. I'm not sure if you can hear me. Soon we'll start, so just if you maybe click whoever likes so I can see that you can hear me. I put some pluses. Okay, excellent. So I can see that you can hear me, so just we'll wait another 3 minutes and we'll start. My name is Dr. Edward Dulitsky. And just before we're starting, so people who already can hear me, so you might have some questions already before you enter in this event. So if I see you can put these questions straight away from the beginning, so if I see them and I will try, might have the answer to them, I will try to put them in when I'm covering the information in this seminar. Okay, it's 1 o'clock, so again, welcome everybody. My name is Dr. Edward Dulitsky and I will talk today about Lyme disease, our journey, our experience, some information probably some of you already know, and some information which was results of many years of our research and trying to find the solutions. So this is my background. I'm actually initially trained in Russia as a physician. I practiced many years integrative medicine. I have specific interest in medical gases, and basically, especially I would say that my first was ozone, and that what brought me into the journey, which was research with Lyme disease and Lyme-like conditions, chronic fatigue. So basically, because I'm not an infection disease specialist, it's so how I got involved. So with ozone therapy, because it has such a big approach, we often would have a patient that would come with strange symptoms and they would ask for help. And that's where many years ago, when we first hear the name Lyme disease, and so it was initially more like a mystery because it was always present like somewhere very far, and until we actually start see the patients and start realizing that, well, we don't know much about it, we don't understand it, and that basically was the beginning of our journey. We come to one conclusion that before you need to help a patient, you need to come up with understanding what is actually happening with the person. So that's why in this presentation, I will be sharing basically our discoveries, our journey, our mistakes, but also we'll start from the beginning, from the classics to understanding what is actually Lyme disease. Okay, I want to also thank you VedaPulse and the team for providing this, supporting this seminar, because without them this won't be happening. And also, but the most, of course, important help, it was the unique diagnostic system that initially, when I first met, I was quite skeptical, but the more I got involved with it, I found more and more fascinating, and eventually becoming a replaceable tool that we're constantly using every day with our patients. Okay, so Lyme disease is another name, often in Europe we refer to this as infectious borreliosis. And why? Because of course it's caused by Borrelia, and there are many types of Borrelia. There are more than 300 Borrelia species. Currently it is acknowledged that 6 of them causing Lyme disease or Lyme-like conditions. Okay, why often we referring, instead of saying Lyme disease, we're saying Lyme-like conditions? So first of all, some of you who comes from the United States, Canada, Australia, you know there is a lot of politics involved, and there is a huge diversity in the medical community towards Lyme disease. You often hear, there is no such thing as chronic Lyme disease, and so there is many different opinions, and often many doctors would just simply get in trouble by using the name Lyme disease. So often Lyme-like condition is kind of a more softer way that you can unite many conditions which have a similar nature, because with Lyme disease often you have a combination of symptoms, different infections, and that's why sometimes it's very hard to differentiate through the chronic stage what we're dealing with. That's why I think in Lyme-like condition it's more proper way of describing this, because it's something that we're dealing constantly with infection, different stages, different side effects. But coming back to actually Lyme disease, it's caused by Borrelia, and there is 6 types of major known Borrelia that's basically causing Lyme disease. It's Borrelia burgdorferi, Borrelia gardneri, Borrelia afzeli, Borrelia bavarensis, Borrelia mayoni, and Borrelia miyamotoi. However, there is more types, and look, in Australia, personally practice in Australia, we have our own type of Borrelia. They all, we can say it's like a cousin, so they have under the microscopes, they're slightly different. They have slightly different variation in symptomatics and in treatment, but basically they're pathogens, they're causing the conditions which we would refer to the Lyme disease. So the history of Lyme. So first medical records related to the illness caused by Borrelia gardneri and Borrelia afzeli were published in 1966, so quite a long time ago. However, the famous name like Lyme, it's kind of basically from the epidemic that was in the United States, in the town of Lyme in Connecticut. There was basically multiple joint inflammation that was caused by Borrelia burgdorferi, and that was basically now most of the population, often when they're talking about the Lyme, they often refer to Borrelia burgdorferi. Okay, so what is Borrelia? Borrelia, it's a spirochete. So it's you can see on the screen. I try to put some pictures. That's how it looks on the microscope. However, what you see there is more Borrelia burgdorferi. Like there is different types of Borrelia that have a slightly different wave. Some of them more straighter. Also, you can see when we see them in an L shape or other. So it can take some different forms. But the most common picture that you see, it's usually, basically you can see this on this picture. You can see it has characteristic appearance, helical, slender, relatively long cells. It's actually quite a big bacteria, which is often much bigger than the cells and very active. So, okay, so how Borrelia is transmitted, probably nearly everybody knows that's the most common way as a ticks. And that's why in many countries we often refer to the same Lyme disease, we call it like sort of tick-borne illnesses. However, a lot of research shows that not only ticks can be transmitting Lyme disease, and like for example, we have our colleagues from Germany who've been dedicated a lot of research to study mosquitoes. They find that mosquitoes can transfer Lyme disease. There is a lot of materials that tells us that basically most of the blood-sucking insects can transfer Lyme. We also, from our experience, we noticed that, for example, often this can be transferred sexually, we believe, because often when one person have Lyme disease within 4 to 6 months, their probably partners also start developing sometimes symptoms, and also we can see it in the blood. So I think there is much more than just saying that poor ticks like the main cause. However, it's probably the most known and the most largest form of Borrelia transmission. Now, a lot of things about, just few information about the ticks, because a lot of people often might never realize they've been bitten by a tick, because sometimes tick bites can be completely painless. They can sometimes come in and come off. First of all, ticks do not always fall from the trees. They can be in the grass, in the bushes, undergrowth. And one more thing, actually, we're always talking about tick bites. However, ticks do not bite. They have no teeth. They start with a swarm. Ticks can transmit Borrelia in all stages of their development, but usually the more older the tick, the more chances of transmission. Also, just important information that I think it's important to know to everybody that no one should ever squeeze the tick or try to suffocate it with the oils, and the best way to take it off is with the bent tweezers. The tick bites often create a specific erythema around the tick bites. However, the presence or absence of this erythema does not mean that you have or you don't have Lyme disease. You can, like I said, you can have Lyme disease without any erythema after the bite. This is what this is types of erythema, which often we refer to as the bullseye symptom. Another name, erythema migrans. You can see the picture. Another thing which is probably most of you aware that while the Borrelia, everybody talks about Borrelia, but the biggest threat is not just the Borrelia, it's a tandem of different bacteria that comes together. So in a way, it's like a team of bacteria that often transferred with the tick bites or with other, and depends on what comes in, you often would either would trigger different symptomatics and different response of the body. So there is a famous, you can see that it's like FSMA, it's basically, it's encephalitis, viral encephalitis. There is also a number of viruses that can be transferred. There is a famous Babesia and Bartonella. They're probably one of the most common co-infections that cause a lot of symptomatics together with Borrelia. Of course, there is rickettsia, there is chlamydia, mycoplasma, filaria, heartworm. So there's quite a range of co-infections that people can get when they're infected with Lyme. Epidemiology. So Lyme disease, Lyme-like conditions are common in basically we hear North America, Europe, Australia, Russia. However, from our experience, like in many countries, Lyme disease often could come as undiagnosed, and we believe it's much more spread worldwide that is actually claimed. There is a lot of political reason for that and also difficulty in diagnostics, but you can say that basically Lyme-like conditions, they spread throughout the world. Usually, classically, we've seen there are 3 stages of Lyme disease. There is an acute stage, we call stage 1, which is often comes after the bite with a bullseye rash. You get like initial response with inflammation, heals, chills, fever, flu-like symptoms, headaches, joint aches, muscle pain, swollen lymph nodes. So this is an acute stage, and however, not everybody has that stage. There's a lot of people who basically got the Lyme without ever getting through the stage 1. Stage 2 and stage 3, basically, it's more describing what we're calling the chronic Lyme. So because it's basically first one, like stage 2, just like expanded rash. It's like, especially if we're talking to the first in the area, like if you've been bitten, the pain in the bite area, often neurological symptoms, which might include paralysis, weakness in the face muscles, what we would refer to as Bell's palsy. There would be severe headaches and neck stiffness, sometimes can cause meningitis, pain and swelling in the large joints, muscle pain, heart palpitation. Stage 3, which we're talking already progression of Lyme, more like it's like a chronic Lyme, so you can see abnormal muscle movement, spasm, joint swelling pain, arthritis, myalgia, numbness and tingling, cognitive impairment, neuralgia, weakness. Okay. This is just like a little picture to make it a little bit more so you can have a look. So there is acute Lyme disease, so incubation time from few days to weeks. like erythema migrans, which is one of the major signs you see often in 50% of the cases, sometimes you don't see. Blood tests would show often lymphocytosis related to response of the immune system to Borrelia. There is often flu-like symptoms, headache, excessive sweating, tachycardia, swollen glands. Again, fatigue is one of the major symptoms that eventually will progress with the progression of Lyme. Like again, neurological symptoms are often present, and basically we can say that Lyme is always target is like one of the things that's brings the Lyme out. It's targeting musculoskeletal and neurological system, and also like chronic fatigue. We can say that this is the three major things that basically typical characteristics for Lyme. Okay, so usually in the beginning, like especially if like it's been just a recent bite, Lyme easy can be response to antibiotics, and like minocycline probably would be one of the first choice, also doxycycline, amoxicillin. However, again, the effect of antibiotics, first of all, what we found, and this has also been already part of our research, that sometimes if Borrelia become resistant, often when you try to attack it with antibiotics, it's become much more aggressive. And also some type of antibiotics can cause it to sort of move to the shape when it's basically like it can drop its like wall and become resistant immune to antibiotics and rebuild yourself later. So there is an alternative approach, which is would come to ozone therapy, also high dose of vitamin C, EHF, laser therapy. So some people might take this as an option. However, most common would be antibiotic approach. Okay, so we're talking now about chronic Lyme. So when the Borrelia is untreated, it resists to the efforts of our immune system or antibiotic treatment. It's sort of progress in the chronic Lyme disease. A lot of Borrelia species increasingly resistant to common antibiotic, and Borrelia is probably one of the most evolved species when it's come to resistance and protection. It can hide inside the other cells, it can develop protective biofilm, it mutates, it can change the shape, developing an L shape, it's produced cellular deficient bacteria. So its adaptation system, its ability to survive, it's quite incredible. And the most interesting that Borrelia somehow, like there is a mechanism basically that it can turn off your immune system from recognizing. So immune system like a turn blind eye, they don't recognize that you actually have an infection. And also it can develop capsules that protect it. But one of the biggest issues with treating of Lyme, it's the fact that it's a mutation that Borrelia can go through, and basically every time changing, and its response and developing further resistance to the treatment. That's why through our research we find that we need to have, when we're starting therapy with Lyme, we need to have like a big range of tools that we can utilize and adapt, because after a while, often, like after initial response, Borrelia must become resistant and no further response to the treatment. So that's one of the things that when we develop a strategy, we always need to develop kind of multi-therapy, multi-tool approach. Okay, this is for you also a picture which is like, it's quite famous, you see it often on the internet. It's illustrate basically chronic Lyme, some major symptoms which like include fatigue, headache, rash, fever, sweats, chills, muscle pain, joint pain, neck pain. One of the very interesting things with Lyme is that it's not just disease of the body, but Lyme disease often would cause cognitive decline, so it's also impact our behavioral patterns. And some of them are very interesting. For example, Borrelia itself is quite sensitive to Lyme, but a lot of patients suddenly become very sensitive to Lyme. So some, for example, co-infection can develop, like, for example, Babesia is very known to cause like anxiety attacks and like night sweating, when Borrelia, the other Bartonella can sometimes make like sort of anger issues, like rage. So basically we can say that bacteria is participating in much more complex mechanism of regulation in our body, including like neurotransmitters, and so there is a changes of behavior, and that's what one of the biggest factors that we need to consider, because while we trying to treat like physiological or actually Lyme disease, often we neglect the situation that patients sort of slowly move what we call into the disease space of mind. So they become a changed people. So it's a lot of like people who, many people who treat Lyme patients, you often know that sometimes it's very difficult to deal with them. Their behavior, their logic, everything changes. And so that's why we often suggest that from the beginning of diagnostics of Lyme, it's very important to have a psychological support and psychotherapy together at the same time with treating the physical symptoms and treating the bacteria. So some of the elements you see: depression, anxiety, of course there is a pain, aches. So, and another big thing is neuroinflammatory reactions in the brain, which is caused a lot of neurological symptoms. Okay, together with Lyme disease, you often comes like opportunistic co-infection, because one of the typical situations with Lyme is always would be impact on immune system. So patients become often immune deficient to a certain degree, and that's why a lot of other viruses and parasites might take an opportunity. So, and that's why dysregulated or damaged immune system often leads to opportunistic infections such as herpes, varicella zoster, cytomegalovirus, Epstein-Barr virus, Coxsackie virus, parasitic diseases, which is often make your treatment much more complex, because we don't know where we're at, what's causing what. Another interesting or important things of understanding Lyme, it's understanding our immune system and what we call cytokine storm, because our immune system often in its trial to sort of fight the infection, it's sending a lot of pro-inflammatory cytokines. So cytokines are small secreted proteins released by cells which have specific effect on the interaction and communication between the cells. A lot of inflammatory reaction in pain are products of the cytokine storm as a result of immune response. And there is some famous pro-inflammatory cytokines, it's like TNF-alpha, interleukin 10, interleukin 12, interleukin 6, interleukin 1 beta, which is often when you do diagnostics, especially if you're trying to have an integrative approach. So it's also a good way basically to check cytokines. But cytokine storm can cause massive inflammatory reaction and basically inflammatory syndrome in the whole body. And sometimes makes it very difficult to treat the patient, because sometimes basically any treatment often can trigger also cytokine storm. This is just illustration for cytokine networks to just give you a little bit more picture understanding of how the cytokines work. Okay, so far everybody can hear me, so everything is okay. So because usually I used to talk to live people that I can see, so that's why I can't see any feedback. So just in case. Yeah, so we have our support team, technical support. So I think if you have any problem with hearing me or understanding, so you can please address the technical support. You just write a message and they will try to assist you. Okay, so I get some feedback that you can hear me, sounds, graphics are fine. Okay, so we continue further to next stage. It's a neurological Lyme. So that's probably one of the most terrible progress of Lyme disease. It's basically when it starts attacking our nerve system, and it can attack like peripheral nervous system. It can attack also the central nervous system. In some cases, we have full body paralysis, sometimes complete cognitive decline. So it's very hard to treat, especially because of the barrier that the brain have, and basically it's probably one of the most challengeable symptoms that we need to address. So just here illustration, so just to remind you about our nervous system. So we have our central nervous system, we have peripheral system. So basically the damage can be anywhere, but however, in most of the cases, usually Lyme attacks the peripheral nervous system. However, it can attack the central nervous system, and especially it's a case of chronic Lyme. Also, Borrelia themselves, they love the what we call the like the structure of nerve cells, because it gives them the right nutrients what they're looking for. Because don't forget, it's still more like a parasite, so that's why they often like to get there. So of course, like the things which is like would be, it's impaired focus of concentration, impaired speech and memory, disorganization. Often we can see the symptoms of Alzheimer's, dementia, delayed mental processing, poor problem-solving skills, and most of the people, they know the word mental fog. This is very typical with Lyme. It's sometimes basically it's a situation for people. It's very hard to think. It's very annoying. It's hard to put like your kind of words together, hard to put your thoughts. So it's something which is quite debilitating for many patients. Okay, so basically, when it comes to treating and understanding disease, so we need, and that's where we started, we try to create like a profile. So what is actually happening? We call it systemic dysfunction profile, and you can see here, so it's basically what we see. It's adaptation, down regulation. That's probably one of the things that a lot of people don't know. What is adaptation, down regulation? In many countries, there is, like in medical schools, they don't put enough attention to the concept of adaptation system. However, like in basically method, adaptation system is probably one of the major systems that we address, because in simple words, adaptation, it's your survival mechanism. And it's the only system that has the power to basically to change what we call to override other compromised system. Many of you who are practitioners probably are aware that when we're dealing with the serious chronic illnesses and the multiple system already compromised, it's very hard to produce a response, because it's like you're trying to fix one thing, something else falling apart. You're trying to fix this, something else. It's basically because all organism is disorganized. It's not responding properly. And we find that basically, especially through a lot of Russian research, that our adaptation system is one of the keys to override and bring back system to respond. And the first study that's probably very interesting to some of you was actually happened during the Second War, especially after that, when basically it was a number of patients with incurable illnesses suddenly just got well without any drugs, any help. And when basically some medical scientists trying to understand that, like, so how is possible? Like, it was because people with cancer and chronic infection, cardiovascular disease, suddenly they just got completely well. So the answer was, it was the stress of survival, because like the chance to be killed, let's say by bullets or shells or hunger, it was much higher than the risk of infection. So the body gets rid of the disease to increase the chance of survival. It was like a biological response. And that was a kind of a scientific shock, because it was the first time that basically it means that we already have it all inside. Our body have a solution that possible to deal with most of the health issues, but unfortunately it was mainly addressed when we come to the situation between life and death. And when they start looking into the history, they find that in all time in different cultures there have been certain rituals which have been trying to simulate this experience. Like, for example, people would be put into a situation between life and death, often to fight incurable illnesses. This, we're talking about like some shamanic medicine. We're talking even, we know in ancient Japan it was a ritual when some of the patients, like when they was on the verge of dying, been beaten up with the sticks. So again, and some of them would come back, and so they're causing that extra stress would put that adaptation resources and makes the adaptation system kind of restart and reset many other systems in the body. That's why like in future we'll describe it a little bit more. We often address adaptation system as a key mechanism for dealing with Lyme and compromised system. So during the Lyme, one of the things happen, it's adaptation down-regulation. So basically our ability to respond and to adjust to the changes that's happening around and within us is getting less and less. So that we have dysfunction of neuroregulation, which is, again, include neurohumoral, sympathetic, parasympathetic regulations, which again, it's one of the natural responses of the body, but which often create the vicious circles, which makes it extremely hard to treat the patient. There is always followed with the hormonal imbalance. One of the big things, of course, since we're dealing with like bacteria, we're talking about microbiome, because science progressed a lot with understanding about bacteria, because I remember like many years ago we have a concept that there is a good and bad, like sort of that all bacteria are bad, we need to kill bacteria. After come to the next concept that, well, there is a good and bad bacteria, some are helping us, some are bad and we need to kill. However, now the latest new concept coming that basically bacteria, it's a world, and there is basically for every our gene there is I think 360 genes of bacteria. So instead of we can say that bacteria live in us, we can say, well, we live in bacteria, and bacteria interact with each other. So that's one of the things that, and actually we've seen that under the microscope, that we're not just dealing with like some bad bacteria who come and attack with you. We're dealing with the changes in the whole microbiome, because like the balance, the ability of our system to keep that balance when one bacteria sort of control the other is often disrupted. And particularly it's happened with antibiotic therapy. And that's why in our approach to the treatment, we're trying to use antibiotics as a last resort, or rather not to use them because they disrupt basically our microbiome, which lead eventually to dysbiosis. And so when we're dealing with Lyme, in probably, I would say, in 80 to 90% of the cases, it would be also intestinal dysbiosis. So all bacteria considered they're all connected, so we need to see and treat it together, especially because our immune system, a lot of its functions, it's basically regulates in our in our guts. Okay, so multiple dysfunction of the immune system, hypoxia, that's another thing which is basically linked to the chronic fatigue. It's a disruption of the oxygen supply, and that happens on many levels. So on one level, we're talking about like breathing and getting oxygen, but the other part, it's basically delivering that oxygen to the cells, to the mitochondria, so they can produce energy. And because most of the, like during the Lyme, especially we're talking like intracellular bacteria and intracellular parasites, they damage the membrane and they damage that ability to carry and exchange the oxygen, which is always lead to chronic fatigue. And in our research of chronic fatigue and treatment of chronic fatigue, probably I would say close 75–80% are more related to damage to the cellular membrane and in what we call structural integrity of the cells. Okay, acidosis, that's another thing which is cause massive disruption in the body because change of pH, it's basically, it's a change of the whole function of the cells in many systems. There is inflammatory syndrome. And when we have inflammatory syndrome, we always would have an oxidative stress and we have additional damage to the cells, damage of DNA. So we will have kind of constantly aches and pains. So it's inflammation itself is one of the big issues with Lyme. The next part, when we're talking about oxygen supply, it's also circulation. Especially, for example, with Bartonella. Bartonella is quite famous to cause damage to capillaries and the circulation, which is often lead later on to cardiovascular symptoms. Metabolic dysregulation, again, changes its metabolism, change of energy. So all of this area, and of we mentioned before, oxidative stress, all of them create often like what we call vicious circle, which is very hard to break because while you're trying to fix one thing, the other elements of it just brings back. And that's why a lot of what we call, there is belief that chronic Lyme nearly impossible to cure, and it is very hard to treat, but the issue why it's so hard to treat because often we don't see the big picture. We don't understand what is actually happening with our patients. Okay, so we come to the next, it's a current diagnostic of Lyme. So, okay, so it's very important, of course, medical history when it comes to the tick bites, clinical data. Like people who've been recently bitten by the tick, it's a very good idea to take them for PCR tests so you can find specifically what actually we're dealing with, what microorganisms are there. Sometimes it's producing excellent results, sometimes it's not. Basically, also the PCR test for the blood, it can be a good idea. However, we find that a lot of Lyme, Barilla, and a lot, especially when you're talking about intracellular parasites, because they're hiding inside the cells, they're very difficult to see through the PCR test. Okay, lymphocyte transmission test, it usually can be done after 10 days of the tick bite to examine organism response to Barilla antigens. Barilla serology is immunoglobulin M and immunoglobulin G after 6–8 weeks, but this often you have an issue with false positive cross reaction. Like, for example, often Epstein-Barr virus might show you like positive on Lyme. So Western blot, it's not probably one of the most reliable testing. However, even with all of this present, like a lot of medical diagnostics, diagnostic of Lyme is still one of the biggest challenge because it has so many forms, and especially when it hides inside the cells, a lot of tests will not pick it up. This is, for example, showing in case of changes in the brain. We can see some lesions there. This is often happening with Lyme. So we come like sort of analyzing the situation, we come into the major hurdles in the treatment of chronic Lyme disease. So why it's so difficult to treat. And one of the things that I came to conclusion, and I have this to discuss with many other leading specialists in the world, that basically every patient is like a separate case of Lyme, because it's like you're treating one patient, but what works for one person might never work for another. So it's like even with treating one disease, but each case is like requires separate strategy, separate approach. Second big issue, especially in many countries, that Lyme disease is, we can say, it's one of the biggest chameleon, and it's can look like many other conditions. Most of the people who we diagnose with Lyme actually never come complaining with Lyme. They came with other symptoms, and we have like people who come and complaining on the back pain or neuralgia or palsy or cardiovascular condition, but we're treating them and they do not respond very well. But when we test them, we actually found, well, there was an underlying factor that's causing all that. The next thing which is very important, of course, it's individual genetic makeup, and because genetically some people have gene expressions which make their immune system less effective. Like, for example, some with compromised CD14 expression like the immune system will not work very well against intracellular parasites. Different co-infection profile, again, because every like combination like of Borrelia with Bartonella, Babesia, they all gives us different symptomatics because they work differently together. And the same with treatment. Like, for example, one of the famous treatment for particularly for Borrelia, it's hypothermia, but hypothermia doesn't do much for Babesia and Bartonella. And often that like variety of and combinations of these different pathogens would create completely different pictures and different response. Okay, different state of immune system. Again, some of them genetic, some of them just to do, like some people just can have other underlying condition which is pushing the immune system. And particularly from our research, we find that basically allergic sensitivities, like unregulated immune system, often patient with such condition would be response much slower, would be much harder to treat them. Now common, of course, like when we're talking about the actual bacteria and fighting bacteria, so it's a resistance. Most of these bacteria, especially when we're talking about chronic Lyme, a lot of them, they are resilient to antibiotics and therapeutic agents. And people, especially who treat Lyme of patients, they know that when we're talking about course of antibiotics for Lyme, we're talking about sometimes 6 months, year, massive. So it's a very powerful course of antibiotics, which also can cause a devastation in our immune system and in our microbiome. Herx reactions, most of you are aware about what's Herx reaction. So basically, it's often during the treatments, it's sudden develop of of like sometimes pain, fever, chills, headache, tachycardia. So it's like things like conditions getting worse, and sometimes this is just like could be an immune reaction. However, even herpes by itself is not a major threat. I still believe that any type of massive reaction, especially when we're already dealing with basically deficient, damaged system, it's something that we rather avoid. So in our strategies, we're trying to base our therapy on subtlety. So we're trying to minimize herpes reactions as much as possible. One of the, again, hurdles of treatment with chronic Lyme disease is like a political division of medical community, because instead of having like a medical community that works together and trying to eradicate this illness, we often find that you go to another doctor, say, no, it's all rubbish, you don't have Lyme. And like also a lot of doctors, sometimes we can say they brainwashed us, they're not trained, they do not understand Lyme, so they don't know the research about that, so they have the opinion. So whatever they tell to the patient is based on opinion, or was it been told by professional organization. Plus, of course, when we're talking about medical professional organization in the government, there is another big issue. It's the cost of diagnostic and treating Lyme disease. And in some countries, like in Australia, the government and it's a policy, like we don't have Lyme. So if a patient comes and complains, and I think have Lyme, the GP will try to give him, like, put him on antidepressant, or just will try to get rid from the patient. So we see a very deep division in the medical community, and because of that, also it's affecting the research and ability to work together to help our patients. And the same coming from this, we come lack of training, because it's not, this condition is not properly taught in the medical schools, so it's more basically individual research. There are multiple organizations, like different societies, like for example in America is very famous ILAT conference. They invited me to be guest speaker last year, presenting our method of the treatment. So they're trying to educate the doctors, they're trying to bring some of the latest research. However, we still have a situation when there is a lot of separation information, very not researched enough. So there is a lot of opinions taken as a fact. So there is still a lot of work, a lot of progress need to be done to be able to prepare medical community that are capable of dealing with Lyme. Next things we talk about the diagnostic. Before that, the diagnosis of Lyme is very complex, and often I see it every time with a Lyme patient, because we have in our clinic we have patients who come from many countries in all parts of Australia, and often the patients are treated based on educational guess, but in reality we don't know what's going on. So somebody has symptoms, like we call Lyme-like disease symptoms, but is it related to bacteria? Like sometimes we do the test, they can become positive, yes, but how the bacteria load? Do the actual bacteria causing the problems, or do something else is present? So differentiation and between different parts of Lyme, sometimes bacteria may be eliminated long ago, but the damage that is done is still there. Patient will still experience certain symptoms. So that's why one of the key issues for us, like in understanding Lyme, was a lack of reliable diagnostics that reflect what is happening with the patient. Also, most of you, and especially patients, are aware of the cost of the treating the Lyme, because most of the treatments they're not covered, they're not supported in multiple countries, and they're quite expensive. So I was reading that statistically, people with serious chronic Lyme condition would need to maintain their state of well-being, need to spend between $40,000 to $100,000 US dollars And this is talking that they travel to different countries, they have a number of different treatments. So it's a huge amount of money, and for many people cannot afford it. So that's also make it much more difficult for patients and also for the doctors to treat this condition. And now we're coming basically to the part of our own, when I would share you our own experience. And basically, as I mentioned to you before, I never intended to treat Lyme from the beginning, but I've been more or less pushed into it. And the more I've been pushed into it, the more I realized how much I don't know, and I needed to learn different things. So in the end, we needed a strategy. We need something that I understand we can't just rely on existing factors. We need basically research. We need to analyze. We need to be able to analyze the problem and find the solution. So, and that's when we come. So we need a different approach to diagnostics, particularly so just immunological reactions is not enough in selection of appropriate treatment. We need something that is, how to say, more close to the patient, that telling us what exactly is happening with the patient. Let's we come to the concept of what we call patient health big picture. So basically, before we treat the patient, we need to see a big picture of what is going on. We need to understand like how's his genetics, how's his resources, how's his nutrition. So we need to see the big picture to be able to understand what is damaged, what is not working, how we can help. And so we're talking about on a functional level, and at the same time, of course, the normal diagnostic procedure is still very important. So, but we need to combine them. Also, from after years of sort of research, we come to conclusion that we do not want to offer antibiotic therapy to the patient because of the damage that it does to immune system and particularly to microbiome, because it's like you winning, we're saying that like you're winning some battles, but you're losing overall the war. And people who have been treating Lyme for many years, a lot of them, they know the story that initially they start antibiotics and they're feeling better, and for a number of years they can function, but after a while things start declining and they come to the stage and suddenly there is no more, things start declining and nothing works. So to me, we were put in a situation where we would need to find a different solution, a solution which can rebuild the immune system, which is probably would be our main goal. Because when your immune system is functioning properly, often it can by itself manage the dealing with bacteria. And this, like our experience, is not just some conclusion. It was we invested a lot of like money. We bought like a microscope. So we've done. For a number of years, we research like what we see. We try different treatments and see what's happening, how things changing. So we probably spend thousands of hours looking under the microscope, understanding the behavior of bacteria. And sometimes certain things that we've seen, it was remarkable. Like I've seen a situation where, for example, you have like sort of Bartonella is out of control and suddenly mycoplasma is coming and suppressing Bartonella. So we've seen how the one type of microorganism actually can control the other without our direct interference. Like we saw like some Borrelia, which will, for example, feed from the fungal, and that will not attack the cells. But as soon as a person would go on antibiotic therapy, it becomes extremely aggressive, and it would move it, because so you can actually see things like that under the microscope. So that's many hours, and that like sort of continuous journey, because like the more we research, the more we're finding, and the more give us insight of trying to find in the concept of dealing with Lyme. So, as I mentioned to you before, like when we analyzed all this problem, we come to the decision we need a new diagnostic system. And we step aside from the standard medical approach and we look into the wellness, because we need something that can diagnose the problem before it becomes serious disease. And the wellness system, there was a number of already existing diagnostic tools, and we've tried many until we select a few. So we created basically with the system, we call it the Wellness Navigator, which is creating the big picture for the patient. And from this picture, we specifically, instead of guessing, we know what is the priority, what we need to do first, what second. So it's become a foundation of our treatment. But so if we select, because it's quite complex, but if we select, if I would say what's the three major tools that we use in our Wellness Navigator system, it would be complex microscopy. So we need actually to see what's happening with every patient in the cells. It's was VedaPulse, functional diagnostic system, which is analyze how the body works based on heart variability, and it was an amazing diagnostic system which is called RDK, which was developed basically both RDK and VedaPulse. It's based on the Russian technology that started still in probably 60s, when it was like when the cosmos become like a future, and the Russian government was spending a lot of money trying to develop a new type of non-invasive diagnostics. That's basically, I believe, this become a foundation of what we see now as VedaPulse and RDK. RDK analyzing the functions of body through the electric activity on the skin, but basically it's very much matching the concept of Chinese meridian system. Okay, so there is a few discoveries like through this process, like which take years of trials and errors. So first, like I just put a few important elements what I thought is important to share. So first, like bacterial load correlates with the symptoms. So that's the one thing that often just being positive in certain bacteria, it's not necessary. We need to see what is bacterial load. So if bacteria can be under control, if immune system controlling it often will not cause an issue. In that case, the symptoms would be caused by something else. The next concept is the same symptoms may have different causes. So that's again, so sometimes your pain can be a result of your bacteria attacking cells, but sometimes it can be your immune response and like cytokine storm or some other issues. It's very important to differentiate one from the other. I spoke before about cellular structural integrity, and for us it's become one of the key markers, especially for chronic fatigue and oxidative stress, because it's very easy to see. And I will give you later on an example on the pictures, so you can actually see what I mean by talking about cellular structural integrity. Okay, the next thing which is also very interesting, as you remember, I talked about like impact on nervous system, and one of the key ingredient of that keeping people sick and or making difficult for system to respond, it's an imbalance between the sympathetic and parasympathetic system. So why it's happening? The issue is that your sympathetic system, it's your defense, it's your fight and flight response. So our body is quite sophisticated to have a lot of sensors. So whenever there is a threat, so we have a sympathetic response. So your sympathetic system telling us, well, it's sending message to adaptation system in the brain, there is a threat. And when we have a lot of bacteria or certain things happening in the body, so of course your sympathetic system responding, it's picking up the threat and it's become very active. And when sympathetic system become active, we call this often referred to sympathetic dominance. So it starts suppressing your parasympathetic system. And your parasympathetic system, we can say, is responsible for two major things. It's your recovery and your digestion. And when we're talking about digestion, also elimination. So the imbalance in nervous system leads basically, because for example, one of champion of our parasympathetic system is our vagus nerve, and as soon as like sort of vagus get affected, so we're losing our ability to digest proteins well, because most of the proteins actually digest in the stomach. So we have a lot of undigested proteins that will be moved and absorbed into our blood, and we would have a massive negative response from our immune system. So our immune system becomes further dysregulated and then start reacting and attacking to the what we call unnecessary allergen, but become deficient in dealing with the virus and bacteria. And as it progresses, it becomes a vicious circle. So that's often become like a situation when most of the Lyme patients have problems with digestion. Some of them have a perfect diet, but still, often the diet and the supplement will not override your nervous system. We're saying the other way, that nervous system overrides the chemistry. So that's why regulation of the nervous system is one of the key elements of treating any Lyme disease patient, because without resolving that problem, you often find that most of the treatment will have only temporarily effect. And of course, the issue with elimination and dysbiosis would lead to toxicity. So it would be accumulation of bacterial toxins, and also we would talk about accumulation of metabolites. And I'm actually thankful to VedaPulse, because I've watched one of the lectures by Professor Sorokin, and he was putting a lot of attention on actually differentiation between metabolites and toxins, which is most of medical practitioners not aware what is the difference. So we will mention further about that. Now, Lyme disease psychological space is a generator of additional psychosomatic conditions. So we talk about like sort of changes of behavior, changes in emotion, and that it by itself become often like a driving factor for people start developing. They so much start living in the disease, they start triggering additional psychosomatic condition. And another discovery that we adding up, it's basically was for us that we should treat the organism, not the bacteria. We often see the case when just the whole people would do anything, just want to kill the bacteria. But and that's what I often try to explain, that killing the bacteria not always is a solution, because we need to make your body well again. We need to make you work, and sometimes it's more important balancing bacteria rather than killing them. And so treating bacteria and treating organism, we still things that need to come in synergy. This is, I'll be sharing with you some of the result of our microscopy work with the Lyme disease patients. You can actually see, basically, I can point here, you can see some Barilla, you can see here intracellular parasites. So you can see basically normally, and that was initially when we started doing research, it was a first shock to us, because as you remember in medical school, we taught that like blood is sterile, but we found that there is a lot of creatures lives in our blood. This is a fake unconscious microscopy, and you can see there is fungus, so there is a mouse, there is a Bartonella, so you can see number of things, which is very important to understand. And that's when we're talking again about structure, because all of the cells that are damaged will not be able to deliver oxygen well. That's other, like this is dark field microscopy. Again, you can see some bacteria attached. While I'm showing some people, if you have any specific questions, again, please put it in. So it would be, and you can see here, see, like normally the red cells, they need to be perfectly round, nice. You can see most of the shape here, like this is damaged membrane. And when you see these pictures that indicate membrane is not required, it would be some inflammatory reaction. And the membrane is very, very important part of our cells, because that's where is a lot of basically receptors for hormones, enzymes. So when we see disrupted membrane, so it would be usually not only in the red cells, would be all over, and that definitely would look to hormonal imbalance and some other issues. This is what you see here. That's basically, it's a mold-like shape. Often in this Lyme, we would refer to biofilm, because basically biofilm often formed by mold and other debris, and it's become a harbor for some of the bacteria can hide, because it's very hard to kill, and it's often, and also it has a lot of nutrients there, so a lot of bacteria would choose to hide. You can see also the fungal element, which often would be candida, which normally we don't think can exist in blood, but you can see it yourself. It's there is a fungal organism here. That's another one. You can see also pictured in a dark field, and you can see that with all this in the plasma, it's extremely difficult for red cells to move. You can see that's another, we can see Barilla. You see on this picture more Australian version, so it's slightly different than you would probably see in United States. So I've seen some United States patients, but that's usually we don't see them as many. We see more Australian versions, so different shapes, different bacteria. Now, so the next part, so you see, so microscopy is very, very important because it gives us understanding of what is happening. However, the part what was missing for the big picture, it's what we call express functional diagnostic, or it's effects of what is actually happening on a functional level with all our systems. That's very important to understand. And basically, it allows us to analyze and select treatment strategies, also to select how to prioritize a treatment. It also allows us to monitor how efficiently our treatment works, because in many situations you probably know, like we treat the patient like for months too, and suddenly realize, well, it doesn't work, try something else. Every time this is happening, we ignoring the fact that the resources in our body, especially with a person who is seriously chronically ill, they are limited, and every time the treatment fails, there is potentially less response for another treatment. So accuracy and selection of the treatment is very important. Plus, it allows us often to identify straight away that, like, it can give you, oh, the body responding to the treatment, or it tells you straight away, no, we're on the long, it's a closed door, we need to find another door to open. So this makes a huge difference, that we very quickly can adjust the treatment. We don't need months to wait to realize the treatment is not working, and we can basically monitor the improvement of the patient using this as a tool. And give us a lot of flexibility, so we can try different treatment, we can straight away still see the response of the body. So it's so basically it's give us much more flexibility in research, and give us much more flexibility in selecting the treatment and to achieving the results. This one, I bring you VedaPulse system, which is I will cover just some part of it, so you understand like, for example, this chart will represent you the balance between sympathetic, parasympathetic, and we can here say it's central nervous and hormonal system. You can see that, for example, here, this is the parasympathetic system is completely suppressed, and, for example, we see the tension and regulation here. So normally, like, it's initial when you look, and that's what happened to me when I first looked. Some of the things I understood, but some look is so complex. How would I know? And to me, I was a little bit skeptical about it until I went and done a training. But when I've done a training, suddenly it was like a wow. Like, suddenly I can see the pictures I couldn't see before. Like, for example, this chart, which is the stress level, will also show you oxidative stress. Like, for example, this part, like it's basically, you see here, there is a lot of Ayurvedic terms, because VedaPulse was basically based around how to bringing a bridge between Ayurvedic knowledge, which is the ancient Indian system, which is more than 5,000 years, into the modern medicine. And Dr. Sorokin, he did an amazing job in trying sort of to suddenly realizing that some ancient terms that we find in Ayurveda, actually they're here, and it's like a different language, but if we're talking modern medicine, they all here. So a lot of the research, you can see a lot of Ayurvedic terminology. However, I'm just trying to put it like I wanted simplicity. I want to understand, and we talk with VedaPulse, and there is amazing lectures by Dr. Sorokin, who's actually translating all this complex Ayurvedic terminology in something that is so simple and familiar to us. So after my training, it was a huge change, and the same was with the case system, which is like initially talking about the meridians. I'll just see if this is still, I will talk later a little bit about the case. So this is again coming to the VedaPulse. You can see, for example, here, these elements would reflect the function of your nervous system, your metabolism, your immune system. Here you would see the function of different organs. So it gives us very comprehensive picture of what is happening with our body. This is another, like this dosha, it's an Ayurvedic term, but it's basically underlying factors. And looking at these underlying factors, we can straight away, for example, see like this element often reflects like sort of neurological situation, like problem, when this one would always like shows a problem with stomach digestion. So it gives you that specific detail that is so important for you when you're choosing the right treatment plan. This is the case system. You see here also looks very complex. It's based on the meridian system, but this system is quite amazing because its database is built from 60s, and it has basically artificial intelligence, so it's all the time collecting the data and adjusting itself to give more accuracy, and it's actually trying to put in terminology of the Western medicine. So it's also it's prioritizing, so it's giving you state, like for example, of metabolism, like just looking here, we can know there is like a lot of toxicity. It can give you the state of how the mental function. So it gives, again, a lot of details, and as you learn them, it makes your life so easier in understanding and diagnostic of your patient. So this is some of the therapeutic principles that we came, like again, and I'm sharing them based on our experience. Like again, we treat organisms, not just killing bacteria. I found that concept of just kill it, it doesn't work, and basically creating the balance, that's probably would be the right words. Antibiotic therapy in Lyme disease for us, it's a last resort. So I'm not saying antibiotics are bad, I'm just saying that sometimes they're necessary, yes, but in many cases, because we don't know other means, they often get overused, and that's causing damage, and when we actually need them, they won't be available because of resistance. Now, complete removal of microorganisms possible in series. That's another thing. I've seen many patients and some doctors who are chasing, they want to completely exterminate certain type of like Borrelia or Babesia or Bartonella. And like again, in the real life, it's virtually impossible because some of them can hide inside your cells and sleep, and they have their own cycle. So even you can kill 99%, if your immune system is not ready to pick up, they will replicate themselves and come back with vengeance. So that's why basically rebuilding of the immune system, I would say it's our major priority, because while we're suppressing, if the bacteria is like sort of overactive and they spread, and we try to clear them as much as possible, but still the most important element is it for your immune system to step up after that and be able to keep the positions. That's what recovery and repair of our immune system is #1 goal for long-term treatment strategy. And again, building of the personal big picture of health is the first step. We need to see constantly that big picture, in my experience, to be able to be effective and efficient, because it always would reflect what we're achieving or where we fail. So seeing that big picture makes treatments much more effective, much more productive, and we are getting really good results. So a lot of the things what I'm sharing, it's not only theory, it's also a lot of clinical experience, and we have a unique facility, and we've done a lot of research which also was correlated with the clinical results. Okay, so we came, basically when we was doing all our research, so we come to the conclusion, okay, antibiotic is not our main tool, so what do we need? How to find the right tools? And that's when we start. First, we put requirements. So what actually do we need out of the treatment? So we need antibacterial effect, we need immunomodulation, immunocorrection, we need adaptogen, so we need to correct and stimulate, upregulate our adaptation system. We need neuroprotection and organoprotection because of the damage that is happening. And of course, we need the detoxification because metabolized toxins building up. We need regeneration and cellular repair, like as you've seen, the cells getting damaged. So if the cells are damaged, and that's probably we find one of the biggest challenges, how to repair the cells, how to repair the energy, because if there is no energy, it's simple physics, nothing can happen. Your body will not have a power for any type of response, even with the best treatment strategies. So we need, again, we don't forget that in many cases we also have viral infection that comes sometimes as a chronic, or it comes on and off, so we need antiviral effect. We need something that's capable of normalizing metabolism, and of course, like we need normalizing hormones, neuroregulation. We need dealing with hypoxia, so we need anti-hypoxic agent. Of course, we need into anti-inflammatory because of our aches and pains, and we need something that can repair psycho-emotional state of the patient. So when we see it, it's a huge amount, but that's basically how we've been conducting. We've been putting like basically what we need. I was trying to look for the agents that actually we can put together to answer all these requirements. So the treatment strategy. So we, again, this is based, it's a method that we developed based on all the research we've done. It's needed more than 10 years of research. So we need a powerful leading therapy. So what is leading therapy? It's when we're dealing with a Lyme bacteria, Lyme infection, you're seeing so much damage and compromise happening everywhere. We find that a lot of like gentle treatments just do not work. No, they just would not produce the results because of such a massive impact, and plus bacteria still often is getting more and more with. So we need something that can change. We need a game changer, and in that game changer, we always consider we need a multi-therapeutic approach, because as we know, like bacterial resistance antibiotics, not only antibiotics, most of the treatment that we choose as a monotherapy in mice, from my experience, bacteria often would become resistant. And that we're talking about ozone, we talk about other treatments, so whatever we're trying to hit the bacteria with, it might, after a while, just become resistant to it. So we needed to have a toolbox of elements that we can combine and individually select, but address that. So second part, we need supporting balancing of the organism based on frequent express functional diagnostic, because when we do this functional diagnostic test, we see that, okay, oh wow, for example, our liver is failing, our kidneys is not working, so we're seeing all the time sort of other things that happen on the periphery, and we know that we need to address the things, because otherwise, again, the body will not respond. So supporting is very important, but it needs to be objective. We need to know specifically what we need now, and we need to be able to monitor quickly how effective what we're doing. Next part is support and correction of adaptation system. Again, as we mentioned before, Russian done a lot of research in understanding adaptation system, and if your adaptation system sitting in the wrong, what we call adaptation mode, your body losing its ability to heal itself. So correcting of adaptation system is one of the key elements that you're using. Next one, stabilization of nervous system. Again, when you have, we discussed it before about sympathetic and parasympathetic nervous system. So when you have extremely active sympathetic system, nothing will work. You have all the time massive reaction, inflammatory reaction. So what do? We're trying to sedate it. This is one of the situations when we need to have a powerful sedation. And because you cannot stabilize, first you need to calm down the nervous system because you can stabilize it. So we use some natural elements for like, so it's herbal. So it's a different, we have like in my particular practice, I use like a different levels. So it depends on how strong that basically sympathetic reactions through the test, our Wellness Navigator, we can see specifically like sort of, we can select what therapeutic agent we would use trying to calm down the system. So some of them can be very gentle herbal treatments, some of them can be, sometimes you require more powerful medication. Now, okay, so immune-friendly and anti-inflammatory diet, and like I always tell my patients, like doesn't matter how powerful the tools, you need to have a foundation. It's what you eat, it's your diet, because if you eat and you trigger immune reaction or you further causing dysfunction of the organs, it will undo all the positive things that you're trying to achieve. So the way how when I select a diet for my patients, I'm considering it, it's like I'm saying, it's a good example, it's like you need to treat like 5 fussy kids, and you have, for example, one food that one kid say, yeah, I like it, but they said, no, I don't like it, I won't eat it. You don't have time to cook different food for each of them. You need to find just one food that all of them would be happy. So when we're selecting the diet, so we need to try to select the diet to make every kid happy, which is first we're looking in the constitutional diet, and VedaPulse is a very powerful tool which specifically can tell based on the pulse analysis which food would be working balancing overall the body. Second part is very important, it's immune-friendly diet. So often we call it allergy elimination diet, because immune system often completely irrational, and like I was telling patients, look, I have patients who come and say, I have all organic diet. I say, it doesn't matter for immune system. You can react to the best food you think. You might have an organic broccoli line, have a massive reaction, and you might have eating McDonald's, and it might not affect you at all. So immune system completely irrational. So it is like, especially allergy sensitivity tests are very, very important to select the right diet from immune system. The third part, we need a diet which is also friendly to our organs that are dysfunctioning. For example, if person we have some liver issues, so we know like he will not do very well on like sort of high fat diet, and or hot and spicy food need to be out. And for example, kidneys, we know like sort of issues need completely different diets. So it's very important. So when we're selecting the diet, we're considering all these elements, and that's why I usually say there is only one diet. It's individual diet made for the patient, and it changes. Like every 3 weeks, normally we do additional functional tests, and sometimes we're changing the diet. But diet is a foundation. Okay, microbiota support. We talk about importance of microbiome. So when we have changes, like we have a lot of like problem with digestion, so we often would have a system when we have a lot of overgrown bad bacteria and lack of friendly bacteria. So in that situation, what is happening, there is a bacteria changing, it's called terraforming, it's changing the way how your digestion works, and after, even if you're putting like good probiotics, they just die, they do not work. It's like a good example. I give to my patients, like, for example, I say, imagine you live in the tropics and you have a beautiful full palm trees, and suddenly, like, so you move to the desert, but you love your palm trees and you're still putting the palm trees trying to grow, they just die off. So it doesn't matter how good is your seed, because the environment has changed. And that's why we use complex probiotic system where we try to reverse the terraforming. So it's, again, coming to VedaPulse, they have a great product that we've been using, which is actually combining prebiotic with probiotic, and we've had really good results with our patients. Active nutritional support through supplementation. Again, most of the Lyme disease patients will have damaged nutrition, again, through digestion, through inflammatory reactions, so it's often just leaving them considering that, oh, they will get the nutrition from the food is often a mistake. So they need the support, and sometimes the support comes with special supplements. Sometimes some of the patients will not absorb them, and in that case it's very important to introduce parenteral form of nutrition, which is usually we're doing through IV, intravenous, like sometimes mice cocktails, or certain elements which we want to build up a certain part that we think is important for our patient. Next one is detoxification and a system of elimination of metabolites. Again, as I mentioned to you before, there is a difference between the toxins and metabolites, and while one need to be removed, in that case we're using a lot of special binders which can help to eliminate and sometimes certain detoxifying IVs, while with metabolites often its optimization of digestion often would lead basically to elimination of metabolites. So, and of course there is also special procedures for detox, but just also as an advice, we need to be very careful with detox, because often Lyme disease patients, they exhausted, they don't have resources, so any strong detox often can just aggravate the condition. So you always need to be very subtle, gentle process, again, individually based. And of course we need to support elimination system, because most of, again, Lyme disease patients that I've seen, they have an issue with elimination. So, and that's a part which you need to be very active, so we can eliminate the metabolites and toxins from the body. Now we're coming to probably the most interesting part of, for me, it's the leading therapies. It's actually what is making, it's a game changers, what is making the difference. So through many trials, errors, look, we find some of the key elements that for us have amazing results without much side effects, and I would put the two of them was the medical ozone and xenon. And now we actually also adding up hydrogen. So I would say there's probably these three gases, they gentle, they're versatile, they have such a massive positive impact addressing all key elements of the body, so they became our biggest game changer. However, as you remember, I mentioned that we always need to have in our arsenal number of treatments. So you can see other treatments that we use, like which is high dose of vitamin C, artesunate, we use photodynamic laser therapy, we use sometimes hypothermia. In our clinic, again, depends where you are. Some countries, hypothermia is easy to achieve. In some countries, like in Australia, we have medical regulation when it's hard to find devices that can reach high enough temperatures. So we have some alternative solutions. They might be less effective, but it's still an important element. And of course, like a last resort, we should never exclude antibiotic therapy out of our list. It should be always on our mind, but again, it's something, as to say, it's a last resort when the other elements are failing, which is we don't see very often with our patients. Okay, next interesting part, supporting therapies. Very, very important. While we have a leading therapies, which is like we consider them a game changers in Lyme. basically supporting therapies. It's something that helps to support and balance the body, which you can do acupuncture, herbal medicine. EHF, we have amazing results with millimeter wave therapy, and EHF, it's basically it's old and modern Russian technology at the same time, which has achieved great results. Aromatherapy, simple things like that, has amazing effect over neurotransmitters, especially with neurological Lyme. And of course, we're talking about quantum therapy, which is like laser, light, frequency therapy. A lot of you experience one or the other type of them, including the right frequencies, including some different frequency machine. And for some patients, find like great support with them. And of course, like some patients we have, they come and tell us they have great results with homeopathy. So this is the part where usually, like particularly, I will give this more freedom to the patient to select their supporting therapies by themselves. However, if they can't, we would recommend somebody. But again, our functional diagnostic is always a key element that can tell us how effective what they're doing. Now, we come into the medical ozone. This is, for us, it was one of the major game changer, because ozone is a very powerful antibacterial agent, and there is not many bacteria that can resist ozone. So when the ozone introduced intravenously, or basically into your body, it produced two major types of reactions. It's called reactive oxygen species and lipid oxide particles. This is basically, you have, like, you can see how it's like a little chart based on single Professor Borch's research, which shows how it's like reactive oxygen species and lipid oxide particles affect different cells, and what they're leading, like you can see, improved oxygen delivery, immune activation, release of growth factors like balancing of nitrogen oxide, generation of supergifted erythrocytes, release of stem cells. So you can see the number, but there's a lot of biological reactions that are triggered by ozone, and one of them particularly, it's ozone. It's a super adaptogen. It's a upregulation of our adaptation system. Now, systemic ozone therapy. So it's basically ozone therapy. We always can divide. This is my forte. I've done Ph.D. based on ozone, and that's something I've been doing over 20 years. So ozone can be divided by two major parts: localized ozone therapy and systemic ozone therapy. So localized, it's used for treating more like a kind of like specific conditions like inflammation in the joint and things like that. So the local, while systemic ozone therapy is used for treating the whole system. And we see there is a number of ways it can be offered, like rectal insufflation, vaginal, so paralymphatic injection, paravertebral. But as intravenous therapies, there is a few famous procedures, like there is water chemotherapy, there is multi-pass therapy, which is currently, by research of Professor Nazarov, was proven that it can be dangerous and should be avoided. There is intravenous ozonic saline solution. This is where basically our research shows our favorite, because it's addressing things that nothing else does. Of course, one of the most powerful, it's EBO, extracorporeal blood oxygen. It's required, but this treatment is quite expensive and not available in many countries. And in the United States, they're using direct intravenous ozone, which is in Europe. We usually say stay away because of potential side effects. These treatments can be very dangerous, but if it's delivered properly, it can be quite effective. Okay, there is 5 types of procedure of systemic intravenous ozone therapy. You can see, like what I mentioned to you before. This is the EBOs, this is water chemotherapy, 10-pass, this is ozonated saline, and this is your direct IV. So for Lyme disease, probably IV, ozone IV is very, very powerful tool. Now, this is understanding about extracorporeal and intracorporeal procedures. This is where I hear a lot of think people come and talking about the 10 parts and how things, but they don't understand sometimes the basic science about the ozone. So the half-life drop of ozone, like you see, it lasts only 1.1 to 0.3 seconds. So whatever the ozone it's added outside of your body, we call it extracorporeal. Okay, by the time it's reaching your blood, it doesn't have any reactive oxygen species. And your reactive oxygen species, that's your major tools, that's the most powerful ingredients against bacteria, the same against cancer, against toxins. Okay, so intracorporeal procedures, the one when the ozone released inside the blood, and because it's producing both reactive oxygen species and lipid oxide particles, so we find it's to be probably, and this has also been supported by our microscope studies, that it shows to be much more efficient. Okay, so we're running like a little bit late. So do you want me quickly to speed up? How are you going with time? If somebody can give me feedback, because I still want to have time for some answers and questions. Okay, so I'll try quickly cover some major things. So xenon is probably our second major element, which is, I would say I'm a pioneer of using xenon for Lyme disease and chronic fatigue. Xenon it's a noble gas. It's one of the things that makes it standing out from any other treatment, that it just does not cause any chemical reaction in your body and will not cause you hex sinus or any reaction, because it's just inert. Okay, so it provides fast and strong therapeutic effect. It's a natural product, not a chemically synthesized drug. Xenon is contained in the air in trace concentration. It's completely non-toxic. It does not irritate respiratory tract, odorless, tasteless, colorless. It's not addictive. It does not accumulate, neither metabolize in the body. Does not enter into chemical reaction inside the body. Non-allergic, environmentally friendly and safe. And in most cases, it's a pleasant experience. And for our Lyme patients, I think that's something that they really need. Some of the xenon action mechanisms, like you can see, xenon is it's a very powerful neuroprotector, and see particularly it's working through blocker of NMDA. However, for me, when we're talking about like sort of dealing with the chronic fatigue, why I'm so much like sort of nearly prey to xenon, because xenon increases the level of erythropoietin, which repairs red cells, repair many cells, and that's automatically basically restore your energy. That's why xenon often used in sports by athletes, particularly in Russia, before it was prohibited by WADA, because it will improve your performance. It improves delivery of oxygen. It improves the function of the mitochondria. Also, another very important element of xenon that was found through the studies, it's that xenon actually creates biochemical electrophysiological changes in the brain cell membranes. However, our hypothesis is it's not only happening in brain membranes, it's happening with most of the cells, and that give us an answer, because we see under microscope how, like after 3-4 treatments of xenon, some of these cells getting repaired. Also, by resetting the membrane, we believe it's basically, again, it's our theory because we don't have the other way to explain it. It's reset intracellular immune system, because after a while, we find xenon just amazing in dealing with intracellular microorganisms. Like when the ozone would fail, xenon just goes through, and we have amazing results with Babesia, with Bartonella, anything that inside the cells. And the theory, because again, noble gases cannot kill them directly, but I think it's reactivation of membrane and intracellular immune system. So this is for you how like protective action through NMDA. So that's particularly very important for people with patients with neurological symptoms. Okay, this is, again, we've done the study. That was something that our theory, so everything so before was like our belief, our experience, but with the help of research center in Ukraine and also with the help of our Russian colleagues, we've done actually the study when we would analyze the effect of ozone and xenon for patients with Lyme-like conditions. So we had a 4 group. We have a group like placebo, we have a group with ozone, xenon, and combined group. And the result of the study was quite fascinating because basically this one I just show you, so it's like some other study was done in relation to the chronic fatigue. It was done in Russia. It shows you basically the positive change, how many elements are changed just through the therapy of xenon. And you can see basically advanced therapeutic effects. Xenon has stabilizing effect of central hemodynamics, improved myocardial perfusion, and has anti-arrhythmic properties, well proven in the complex treatment of coronary artery disease. This is all based with the Russian research. In the treatment of obstructive and restrictive lung disease, xenon is used for its ability to improve permeability through alveolar capillary membrane and to relax smooth muscles. Possessing pronounced anxiolytic, neuroprotective, and nootropic properties, positively influences microcirculation. Xenon has found its use in the treatment of ischemic and disrupted brain lesion, which is particularly, again, this is, we're all talking some of the things we see in this Lyme. The pronounced muscle relaxant and analgesic effect of xenon is used in the treatment of reticulitis. Xenon is successfully used to treat disease associated with dopamine and serotonin metabolic disorders, psychosis, depression, borderline states, which is again we see with our Lyme. And it is also used in addiction, like for with drugs, and so which is with the very famous Dr. Vorobjov's clinic in Europe, which make it one of the most effective treatment for drug addiction. So xenon, this is administration. So normally xenon, and especially in Russian research, it was done always by inhalation. We, and also with our Ukrainian colleagues, first time in the world, we used xenon actually injection and also rectal insufflation, and also it worked quite well. This is for you comparative properties of the xenon and ozone, why sort of we selecting them as see, if you remember, like requirements we're putting in, you suddenly find that a lot of answers on the properties of xenon and ozone. This is, I'll come back to this, our combined ozone and xenon trial, which is we've done basically, and it was 14 treatments with 40 people, and with the ozone over just approximate result was a 50% improvement. With xenon was close to 60, but with combined effect xenon therapy, it was more than 70% of our patients would experience some level of improvement. And if you look for chronic fatigue, muscle pain, neurological symptoms, depression, anxiety. So it's some of the key symptoms with Lyme. This is again one of the, in the end, I just want to show you one of the our patient, like a case study. You can see when she came to us, a lot of borrelias, a lot of damaged cells. She had a lot of, she came to me initially with basically complaining on the sciatica, and she also have peripheral neuropathy. She have basically partial, like sort of trigeminal neuralgia. So she had a lot of different symptoms, and as we start treating, she was initially improving a little bit, but I've seen something is not right, something is wrong. So this is where we recommended to do our Wellness Navigator test, and this is like very interesting how, like with the VedaPulse, and just to show you some elements, like for example, like this is more represents the nervous, and we can see that between this, that her nervous system and digestion is not working properly. We can see stagnation of energy. This element indicate basically there is a lot of critical state in her well-being. We can see this element indicates that she also have issues like with mind functions. So there is all of this have its own explanation. You can see like there is basically a lot of imbalances in the body. Like you can see extremely high, basically it's a stress factor. This is represent inflammatory reactions. So just let me go to the next slide. And this is like you can see after the course of treatment how much cells changed. And also you can see that we can see through local diagnostics the changes also happening on the functional level. You can see just simply here, like again, and go back so you can see how many, like see this yellow indicate a problem. So you have stomach, pancreas, heart, urinary bladder, kidney. So all of this indicate functional problems, and it's kind of changed basically through the course. Okay, so I finished my presentation, so now I have probably 15 minutes to answer your questions. Is there any questions? Okay. Well, VedaPulse, like I can see the one of the question here is in the chat, like sort of. So I'm reading it. I'm interested in I'm interested in VedaPulse apart from with Lyme, how you are using it in your clinic. We're using VedaPulse as a part of our fundamental functional diagnostic, because VedaPulse would give you ability to understand what is happening with your patients on the different levels, including like sort of underlying conditions and certain symptoms. So that's why I would say I don't have a patient who comes for internal treatment that we do not use VedaPulse, and always VedaPulse is one of the key elements because it's so fast that we can monitor how effective what the patient is doing. Yes, some of our patients we give us a home unit so they can basically measure. This is one of the things that's very good to do, especially when you're monitoring the patient, because when they refund, they can send you the readings and you can use them to adjust over the line, especially supporting therapies. Especially if you're trying like sort of, now in the time of COVID is very, very important because it gives us much more flexibility in dealing with like sort of online, helping our patients online. Any other questions? I'm based in Australia, in Sydney. There's another question where I'm based. So. Any other questions, any feedbacks, or if anything, it was, I'm not sure how was this information for you, so. Look, I'm not sure because unfortunately a lot of practitioners, like we're not united yet, so I don't know if there are any other practitioners using VedaPulse in Melbourne. There is a possibility. Like I've done a lot of training with VedaPulse, and the more, like I said, like initially being honest, I was quite skeptical. I didn't see the basically the full usefulness of the program. However, the more I use, the more I've been converted into and it's become my very powerful tool. Yes, EHF therapy, especially we have some new modification in EHF therapy. It's become our a new a game changer with Lyme disease, because there is new technology was developed by Alexander Puzankov, which is basically it's changing completely. It's much more powerful and basically doesn't have the side effects. So we don't have so many Herx reactions. And basically, EHF therapy, in simple words, it's a communication cell technology. It's allow us to deliver messages to the cells, basically anywhere in the body, including brain, including cell potential. It's huge. So it's something that we've been using before, old technology, and we've been happy but with the new technology that has arrived, the result. It's changed so much, and it's relatively new. So I probably would be able to have a feedback or maybe a lecture on one stage describing all of it, but it is very, very promising. Any other questions? Okay, so it looks like everybody understood what I tried to say, so it took a bit longer. So I just would like to thank you all for listening, and you can always get and get in touch with me if you have any further questions. And so thanks again. Okay, bye.